Bismillah ar-Rahman ar-Rahim. Acute myelomonocytic leukemia. Acute leukemia. Types of the acute leukemia. There is two types of the acute leukemia, which is acute myeloid leukemia and acute chronic leukemia. Let's talking about the acute myeloid leukemia. Acute myeloid leukemia is defined as the cancer of white blood cells in which cells fail to differentiate into mature cells, thus productions of high number of the blast cell, usually more than 20% in the bone marrow aspiration. Classification of the acute myeloid leukemia. Regarding the FAB classification, there is 7 types of the acute myeloid leukemia from M0 to M7. What important to us is it's the M4, which is the myelomonocytic leukemia. Regarding the WHO classification, it classified under the AML with genetic abnormalities which include inversions of the chromosome 16, 13 and 22 and translocation between the chromosome 16 or between the chromosome 13 and 22. Acute myelomonocytic leukemia or M4 is defined as a form of the acute myeloid leukemia that involves more than 20% in the whole classification or more than 30% in the FAB classification of the myoblast in the bone marrow aspiration. AML or M4 is a common type of the pediatric AML. Clinical presentation usually fatigue or asthenia, which is often accompanied by persistent fever. Severe infections might occur due to diminished neutrophil count, although easy bruising, Barber or Petici, bleeding resulting from the thrombocytopenia. Although there is a pallor due to anemia or decreased hemoglobin level, and it may be accompanied by dizziness and headache. Also, although there is dyspnea or hypoxia, result from the leukostasis, and the last one is the neurological symptoms may occur, which include headache, nausea, vomiting, cranial nerve pulses. Classification of the acute myelomonocytic leukemia M4. We have the M4EO subtypes refers the eosinophilic cells, and we have the M4 Bezo subtypes reveals the basophilic cells. Investigation. First, CBC. Usually, breathless, hemoglobin and RBC decrease in level, while WBC may be decreased or increase. Blood film, there is increase in the monocyte level in the peripheral blood. And the bone marrow aspiration, after the morphological analysis, they shows by the granule gisma staining generally shows a mixture of the myoblast more than 20%, monoblast and the monocyte. There is another investigation which include the lineage confirmations. There's immunophenotyping and cytogenetic. Immunophenotyping usually reveals positive for CD13, 14, 15, 33, 34, 64 and 65. The last one is the 117. Cytogenetic. The most widely observed chromosomal abnormalities in EML M4 is the invergence 16 aberrations, which is a typical of the M4 eosinophil variant. Investigation. Although there is cerebrospinal fluid examination is mandatory in order to exclude the central nervous system invasion, which is defined as more than 5 cells per millimeter and the presence of the myoblast. The last one is the radiological investigation, which include chest x-ray, abdominal ultrasound, and in case of the neurological symptoms, combined tomography and magnetic resonance imaging of the brain. Differential diagnosis. Malignancies that should be differentiated from the acute myeloid leukemia actually is include of the acute lymphocytic leukemia, myelodysplastic syndrome, chronic myeloid leukemia, and we have the last one, bone marrow metastasis of the solid tumors such as neuroblastoma, even sarcoma, bone marrow invasion by non-Hodgkin lymphoma. Non-malignancies disorder must be differentiated from the AML is transient leukemia reaction, Genital chronic arthritis, infectious mononucleosis, viral induced bone marrow suppression, aplastic anemia. The last one we have the congenital or the squared neurotopnia and autoimmune cytopenia. Prognosis. Outcome of the AML actually remains poor with an average survival of the 35 to 60%. While in children with the AML M4 carrying the inversion 16 abnormality have a better prognosis, 61% actually of the 5 years overall survival. Treatment. We have general treatment and specific treatment. General treatment include blood transfusion, platelet transfusions, antibiotics, and drug inhibit vomiting in case of the vomiting. Specific treatment actually it's done because or the goals of the special treatment is to have the complete remission. What is the remission? Is the clear the blood from the blood cell. Treatment patient with low risk. First we have the induction, which is the intensive combination chemotherapy, include drugs such as anthracyclines, which is the daunorubicin, cytosine, and arabinoside. Although there is consolidation with a minimum of 5 cycles of treatment, the last one is the CNC prophylaxis. In case of the patient more than 16 years old, if he had bad general condition, we give him general treatment with or without single chemotherapy. If he had good general condition, use the combination of the chemotherapy. The last one, if the patient didn't respond to chemotherapy, patient must be treated with the stem cell transplantation, and he must be have good risk and allogenic for this transplantation. Thank you for listening. This presentation is done by my colleague محمد حسين فطاني، حسين رضا السنان، حسن العيدروس، إبراهيم الزهراني، عبد العزيز الزهراني، عبد الله ثقة، فهد الحارثي. والسلام عليكم ورحمة